Hi friends, we will discuss about IV cannula insertion, that is also called as intravenous catheter insertion. It is one of the common procedures done in a hospital setup. Most of the hospitals prefer to have an IV cannula for all their inpatients, because, at the time of medical crisis, it will be helpful. Let us begin with the major purposes of IV cannulation. Some of them are, number 1. Administration of medicines. Number 2. Fluid and electrolyte replacement. Number 3. Administration of blood or blood products and total parenteral nutrition. There are two main considerations you have to keep in mind while plan for an IV cannulation. Number 1. Anatomical and physiological consideration of the patients, such as age of the patient, physical condition, and disease conditions. Number 2. Therapeutical considerations, such as the treatment plan, amount of fluids required, and type of drugs planned to administer. For example, pH and viscosity of the IV medications. First, let us examine the anatomy of the vein and difference between an artery and vein. There are 3 layers in both artery and vein. They are tunica intima, tunica media, and tunica adventitia. The major difference between an artery and a vein is that valves are present in veins. It prevents the backflow of the blood. Site selection. Cephalic veins are those found in upper side of the hands, and basilic veins are those found on lower side of the hands. Cephalic veins are the most preferred and first choice of veins for IV cannulation, because they are bigger in diameter, straight in shape, well supported away from joints. Metacarpal veins are not the first choice for an IV cannulation, because they are small in diameter, not so straight, and there are chances of frequent movements of wrist joint. What are the characteristics of an ideal vein for IV cannulation? It should be visible, palpable, straight, away from valves, big enough in diameter, away from joints, and above previous puncture sites. Special considerations and contraindications. Try to use non-dominant hand. Avoid thrombosed veins, which are hard to touch. Avoid areas with compromised circulation or sensation like paralyzed hands or fracture. Always remember that cannulation in joints should be avoided, because increased movements can cause many problems like pain, edema, disposition, and many more issues. Avoid IV cannulation on hand, where there is presence of AV fistula and the affected arm of a mastectomy patient. Device selection. Purpose of therapy and patient's condition help us to select a suitable device. IV cannulas are color-coded according to its size and length. Diameter of a cannula determines the flow rate. These are the color codes and size of different IV cannulas. Orange, 14 gauge. Gray, 16 gauge. Green, 18 gauge. Pink, 20 gauge. Blue, 22 gauge. Yellow, 24 gauge. Purple, 26 gauge. As the gauge goes up, the size becomes smaller. Large bore devices are selected for surgical and trauma patients, who requires large amount of IV fluid and blood administration. Age of the patient, diameter of vein, and the character of the drug administered are also important criteria for the selection of IV cannula size. In short, site and device selection are largely dependent on multiple factors. Preparation for IV cannulation. It is very important to provide adequate explanation about the procedure and get permission of the patient before starting IV cannulation. As per hospital policy, arrange required articles in a tray and keep it within reach. Some of the basic articles to be arranged are gloves, tourniquet, linen saver sheet, cleaning agent. It is preferred to have 70% alcohol with 2% chlorhexidine, cotton pieces, and gauze. IV cannula, 0.9% of normal saline in 10 ml syringe to flush the catheter, transparent adhesive film, a separate tray to discard the wastes, and puncture-proof container to discard the needle. If you are using IV extension line, connect it with the saline syringe and prime it to remove air. Preparation for procedure. Provide comfortable position to the patient and keep the hand supported. Inspect the arm to identify a suitable vein. If you find it difficult to cannulate or you are in doubt that whether you will be able to do it, take the help of expert nurses. Place a linen saver pad under the patient's arm. If excessive hair is present at the puncture site, clip it with a clipping machine.